Welcome to our briefing today towards healthier outcomes in surface transportation. I'm Dan Brissett. I'm the president of the Environmental and Energy Study Institute, and I would like to start with some thank yous. Number one, thank you to Representative Paul Tonko and his great staff for helping us get the room today. I'd also like to say very special thanks to our partners, Transportation for America and the American Public Health Association. They've been great to work with, bringing this topic to you all today for folks in the room, but also folks in our online audience. And they were very nice enough to also help us provide a little bit of a snack. So please grab a bite. The time to do it is now. It's a lot better to interrupt me than it is to interrupt one of our panelists. But please grab a bite and feel free to help yourselves. Thank you. That's very nice. Thank you. We should all give them a thank you. We'll give them nice applause in a moment. For more than 40 years, EESI has brought nonpartisan, science-based information to Capitol Hill. We were founded by a bipartisan group of members of Congress, and since 1984, we have worked to provide science-based information about environmental, energy, and climate change topics. Our work has always focused on the multiple benefits of win-win climate solutions, benefits like energy affordability, better economic outcomes, enhanced grid resilience and readiness, and improved national security, and international competitiveness for U.S. companies. And in the case of today's briefing, better, healthier options for moving ourselves around this great big country of ours. Our congressional education looks like this, lots and lots of congressional briefings. If you're new to EESI, I encourage you to check out our briefing series that wrapped up a couple weeks ago, Congressional Climate Camp. We cover topics like the budget and appropriations process, which is we also covered reconciliation, so very, very timely given what's happening these days. We also talked more in detail about surface transportation reauthorization. We did a briefing about climate modeling and the impacts of different solutions available to us. And we did a briefing all about jobs, jobs, jobs. Everything is always available online at www.eesi.org. And if you're not already subscribing to our biweekly newsletter, Climate Change Solutions, I hope you'll give that a look because it's a really great resource and really the best way to keep up. We try really hard to make sure that our resources are timely, relevant, accessible, and practical so that when your bosses come to you with a tough question, in today's case about transportation and climate, you'll know that you can come to EESI and we'll have resources all ready to go. It's much better to have that information before you need it than after you need it. And if there are gaps in information, if there are things that you're not seeing out there, I hope you'll contact one of us, send us an email, reach out, and we can help you hopefully fill that information gap. For example, we have a lot of briefings coming up in the next couple weeks and months about surface transportation, so that when we get to that, there'll be lots of great resources. In fact, we should just take a moment to talk about two of our upcoming briefings. One, Risky Business, Insurance in the Area of Climate Change. That's a pretty good briefing title. But what about that other one? Like trains, then choose to learn about federal rail policy? You all should just come to the briefing just based on that. Stick around for the first couple minutes and then, no, seriously, that's going to be a really good one. We're coming due for a surface transportation reauthorization, and that means we'll be revisiting decisions about how we plan for and fund transportation and mobility solutions. And that gives policymakers an opportunity to think about federal policies and investments that also shape public health, prosperity, and climate outcomes. And even if we weren't thinking about a new highway bill, transportation sector actually deserves a lot of our attention. Last week, we did a briefing about the 2025 Sustainable Energy in America Factbook, and we learned that the transportation sector itself accounts for almost 30% of total energy consumption in the U.S., and it's a major driver of overall petroleum use. Electrified transport in particular has been among the top 3 areas of clean energy transition investment over the past few years, dating back to the enactment of the Infrastructure Investment and Jobs Act. And speaking of jobs, more than 2.5 million people are employed in car and truck manufacturing in 2023. And that's partially driven by the increasing popularity of electric vehicles, and there are more than 1.5 million electric vehicles sold in 2024. That's the most ever. If you want to learn more about that briefing, it's the presentation materials in the video. You can find that on www.eesi.org. But as we're about to learn, transportation is much, much more than just the cars and the trucks and the roads and the bridges that they drive on. And how we get around in the United States is an absolutely fundamental part of our society. And each decision about how we get around has major implications for public health, too. Public health and climate change are inextricably linked. This is a big topic, and thankfully, we have 4 really great panelists who help us understand that nexus. If you have a moment, we encourage you to take our survey. If you have any comments about the programming, if you have ideas for additional topics, if you're in our online audience today and you're having a problem with the video or the audio feed, please let us know. We read every response and we really appreciate that. We will have time for questions after our fourth presenter. For folks in the room, we'll have a microphone. You can ask questions of our panelists. If you're in our online audience, I hope you'll send us an email, and the email address to use is ask, that's ask@eesi.org, and we'll do our best to incorporate those questions into the discussion, and we'll be doing real-time coverage on our Blue Sky and Instagram story. But first, we have a very special guest joining us via video remarks. Representative Mark Takano represents the 39th District of California, and that includes communities in Riverside, Moreno Valley, Jurupa Valley, and Pérez. He serves as ranking member of the House Committee on Veterans Affairs and is a member of the Education and Workforce Committee. Before he was elected to Congress, Representative Takano was a longtime educator and transformational leader on the Board of Trustees of Riverside Community College. Thank you. Thank you, Dan.
Good afternoon. Thank you to my friends at the Environmental and Energy Study Institute, the American Public Health Association, and Transportation for America for the opportunity to speak. This conversation comes at a critical time as Congress begins to discuss the surface transportation reauthorization process, which could be a unique opportunity to address the nexus between public health and critical infrastructure projects. I address you today not only as a co-chair of the Future of Transportation Caucus, but as the representative from California's 39th Congressional District. Riverside has seen rapid economic growth in the 13 years I have represented the Riverside area, but with that growth has come an increase in pollution spurred by commercial traffic and vehicle emissions. This growth has led to the Inland Empire having some of the worst air quality in the United States. This impacts my constituents. Poor air quality means more children with asthma and elderly individuals with more lung issues. Air pollution costs Riverside families an average of over $4,000 each year in healthcare costs and insurmountable costs for many families. These realities compelled me to form the Future of Transportation Caucus because we must find a better way forward. We are at the precipice of a transportation revolution with clean air cars, trucks, and public transportation all possible today, but only if we work together to defend the progress we have made and advance these technologies forward. This is a difficult time for our efforts, but this is not a fight that we can afford to surrender. We must address air pollution and climate change with fierce energy. So today, as you hear from these experts from across disciplines, be thinking not only of what their work means, but how we can use their insights to build a better world today and for future generations. Thank you all and enjoy the briefing.
Thank you, and my colleague Dan O'Brien. Thank you for that. So that brings us to our first panelist of the afternoon, and that is Megan Latshaw. Megan is Associate Teaching Professor at the Johns Hopkins University Department of Environmental Health and Engineering. Megan translates environmental health science to policy and practice, with a focus on making the healthy choice the easy choice. She rejoined the Johns Hopkins faculty after working for more than a decade in the nonprofit world, and at that time she served as the environmental health director at the Association of Public Health Laboratories, where her team focused on creating a national biomonitoring system and on testing for agents of chemical terrorism. Before that, Megan served as the senior director for environmental health policy at the Association of State and Territory Health Officials. Megan, thank you so much for joining us today, and I'll turn it over to you.
Thank you, Dan. Hi, everybody. Thank you for coming. It's great to see so many faces. So I work in public health, and in public health, actually, before I even advance, what we talk about is we talk about death and illness for the most part. Now, we're shifting, and we're starting to talk about well-being and thriving and things like that. But what is making Americans sick, and what is killing us? These are the top 5 causes in 2023. Heart disease, cancer, unintentional injury, stroke, and lower respiratory disease. These are not infectious diseases. And yet a lot of public health focuses in on infectious diseases. But I'm about to show you a lot of these are linked to transportation. So I'm going to pick one chronic disease and talk you through a couple years of data. So obesity in the US, this is a map from 2011, and you'll note most of the map is yellow. And we're going to fast forward to 2013, where you see a new color has appeared. It's like a brighter-ish orange. It's where 30 to 35% of the people in those states self-reported as being obese. So fast forward again to 2019, and the majority yellow from 2011 is now gone. This is 2011, and now we're in 2019, and there's another new color, and now we're looking at 40 to 45% people self-reporting as obese. This is 2022. This is in the middle of the pandemic, so maybe we had an excuse for not being the healthiest, but you see there's another new color that's 45 to 50% of people reporting as obese. And this is the last year we have data for. You can see it's still pretty much bright red. So what is my point? My point is, when we think about chronic disease like obesity, in public health we think about how to prevent that, right? And so we look at the risk factors and the causes. And when you talk about chronic diseases, the risk factors are age, family history, diet, exercise, smoking, alcohol, environmental factors, stress, sleep. But of these, we can't control them all. We can't control our age as much as we might like to. We can't control our genetics as much as we might like to. Stress, maybe that's debatable. And so what's left? Well, the majority of what is left is behavior. Diet, exercise, smoking, alcohol, sleep. How are we doing in this country when it comes to telling people they should eat healthy and exercise? Not great. So I don't know if this is going to work. I should have warned folks ahead of time. Somebody's laughing. Hopefully, okay, it didn't work, which is fine. That, if you don't know who that is, his name is Jack LaLanne. And in the 1950s, he used to talk to people about how to eat healthy and exercise. I'm going to click on that and see. Maybe it will work.
Do you know that the average person in this great land of America, they have no conception of what this wonderful body that the good Lord above has given us, what it's made of, and how to keep it in repair, what foods we should be using in order to help this body to be more youthful instead of getting older every day. Am I right? You go down to your favorite supermarket or chain store today, and you just watch the people as they buy their groceries and take a peek into the shopping cart, then watch the person that's pushing that cart. And you can see that the healthy, happy, handsome people are the ones that have the natural foods in that shopping cart. And the people, on the other hand, the ones that are completely out of condition, they're miserable and unhealthy. You watch their shopping cart and see how many processed, man-made foods and high-calorie foods they have in that shop.
All right, so you get the idea. I like that handsome people eat healthy. I'm not sure about that, but everything else you should get the idea of. So what's left? If we can't control part of these, we're not doing great with the others, the behaviors. The last thing on the list is environmental factors, and that's my area. This is what I try to look at, is how do we change our environment to make the healthy choice the easy choice? And so this is how we've built the environment in the United States. We have built America for cars, not for people. When I first saw this, I thought it was fake. I thought it was like computer generated. If you're from LA, you might recognize it. It's real. And, cars run on money and they make you fat, and bikes run on fat and save you money. So, what were we thinking? I know what we were thinking. We didn't realize. You make these decisions, you get excited about the latest technology, and then you adopt it. Americans we drive a lot, about 15,000 miles a year, which is an increase from 2021. We spend about 27 minutes on average commuting one way to work. Some of us, I used to commute to DC from Baltimore, it was 90 minutes each way. That equated to a month of my life every year spent commuting. A whole month of my life every year. So when we drive a lot, what does that mean for our health? Well, it leads to injuries. There's a lot of motor vehicle crashes in the US. Some of you in this room look pretty young. So in the first 3 decades of life, the major leading cause of death is unintentional injuries, which includes motor vehicle accidents. About 42,000 people a year die in these, and about 2.5 million people are injured. Doesn't even talk about the amount of money that's spent on these injuries or deaths or even physical damage to cars. We heard from the representative about air pollution in Riverside, California. He said it costs $4,000 on average to families every year in his district. In Maryland, where I live, there's about 600,000 Marylanders who have asthma, and air pollution is linked to asthma. Air pollution is linked to diminished lung function, which is another 200 to 400,000 people in Maryland. It's linked to heart attacks. It's linked to adverse birth outcomes. A lot of people think, like, yeah, of course it's linked to asthma, but they don't realize it's also linked to adverse birth outcomes. It also increases your risk of cancer, and it increases your risk of death. So air pollution is bad, and most cars, if they're burning, any car burning fossil fuels, or any vehicle, is contributing to air pollution. If you're in a car, you're probably not being as physically active than if you were walking or driving. And yet, if physical activity were a pill, it would be the most effective drug on the market. This was a quote from somebody who used to work at CDC. Our children are not walking or biking to school anymore. In 1969, about half of kids walked or biked to school. And in 2009, it was down to about 10%. That's not because they live further away from their schools. In 1969, 40% lived within a mile, and in 2009, 30% lived within a mile. So a slight decrease, but not enough to explain the difference. Maybe that's because we have designed our communities, again, for cars and not for people. So if you lived in a community like this, maybe you wouldn't be that excited about biking or walking to school either. Physical inactivity is a huge impact on our health. It contributes to heart disease, diabetes, cancer, obesity. It's estimated to cost $117 billion in healthcare alone every year. Only 1 in 4 of us adults get the recommended daily activity, and 1 in 5 high school students. In Maryland, 20% of adults say they didn't do any physical activity in the last 30 days beyond what they're required to do to live. So transportation is linked also to access to things. If you have transportation, whatever it is, a bike, a car, public transit, that gives you access to healthcare. If you don't have transportation, you can't get to your physician appointments to check on your diabetes. If you don't have transportation, you can't get to jobs. This was a study done in Baltimore that showed if they build a red line connecting East and West Baltimore, it's a light rail, that would significantly improve access to jobs in Baltimore. So it's linked to access to jobs. Transportation is linked to getting to school in Baltimore. In Baltimore, public school kids have to take public transit. If their bus is less than 7 minutes late, it's considered on time. They are not considered on time if they get to school 7 minutes late, or if they have to take if they have to transfer to another bus. Transportation provides access to nature, which impacts our physical and mental health. Nature is linked with reduced stress, improved sleep, reduced depression and anxiety, greater happiness levels, reduced aggression, reduced ADHD symptoms, lower diabetes, pro-social behavior, lower blood pressure, decreased asthma and allergy, better general health, smoother post-surgical recovery, which is interesting, better birth outcomes, improved pain control, lower obesity, and longer life expectancy. If you ask me if we could package nature into a pill, maybe this should be the most prescribed pill out there. But there are things like healthy community design. All is not lost. We have hope, right? This links destinations that promote health via transportation that facilitates safe travel. And I like to say healthy community design makes the easy choice the healthy choice. Is it easier for you to get in your car? Or is it easier for you to jump on your bike or walk or wheel yourself or whatever? The Urban Land Institute has these evidence-based recommendations on how to design healthy communities. It includes well-connected street networks, sidewalks and pedestrian-oriented streetscapes, biking infrastructure, access to nature, social engagement, all of these positives. So in summary, we need to make active transportation easier for Americans. We have a serious chronic disease health issue in this country, and if we can decrease the number of cars on the roads, that's going to lower injuries, reduce air pollution, reduce greenhouse gases as well, which I didn't even talk about. It increases physical activity, increases access to healthy food, nature, jobs, education. It increases social capital. We have an epidemic of loneliness in this country. The more that you're out in your community and the more that you're not stuck in your little vehicle, the better social interaction you're getting. And all of this will work to improve the health of Americans, make Americans healthy again, right? So I always have to acknowledge the folks who I stole slides from, Dr. Schwartz, Dick Jackson, Howie Frumpkin, and that is it. Thank you so much.
Well, I mean, I think we have to listen to what Jacqueline Lane said, because he sat backward in a chair. And if anything, raises credibility with younger people, it's sitting backwards in a chair. I guess maybe I feel a little guilty sitting here listening, but if you would like to get out in your community and you want to listen to stuff about interesting climate solutions and things like that, you should subscribe to the Climate Conversation podcast. It comes out every couple weeks. Just did an episode about abandoned mine lands in West Virginia and economic development opportunities that come with that. We've got one coming up in a few weeks about the nexus of sports and climate. Should be really good, and we've got all sorts of great other episodes. So you can do that while you're out and about in the world getting some exercise. That brings us to our second panelist. Keshia Pollack Porter is the Bloomberg Centennial Chair and Professor at the Johns Hopkins University Department of Health Policy and Management. We're really doubling down on Baltimore today. Keshia is an injury epidemiologist and policy researcher who specializes in health equity and promoting safe environments. She uses research to advance policies that create safe and healthy environments with an emphasis on addressing structural drivers of health through policy change and promoting effective cross-sector collaborations. Keshia also directs Johns Hopkins' Institute for Health and Social Policy and the Health Policy Research Scholars Program, and is a member of the National Academy of Medicine. Keshia, thank you for joining us today. I'll turn it over to you.
Good afternoon, everyone. Thank you for responding. So I would have said it again if you had not, just to let y'all know. I'm thrilled to be here. I want to just begin by acknowledging EESI, APHA, and Transportation for America for this briefing. I'm grateful to participate in talking about how do we center health in transportation. Megan provided such a great overview of the ways that health can be impacted by transportation. And I'm going to talk about how we can be intentional about working together across sectors to lift up health considerations during decision making. So I hope you would agree with me that multiple sectors influence health. Think about transportation, of course, that's why we're here today. But also think about housing, think about energy, think about education. And so for me as a public health person, I appreciate that decisions made in these other sectors impact health, which sometimes is a problem because health is not the focus of those decisions. But because of that, I believe there is a tremendous opportunity for us to work together in a more intentional way to center health in our decisions, particularly in decisions related to transportation. Dan mentioned that I'm a health equity researcher, and while that word sometimes creates a lot of angst amongst people, I want to say health equity is for all of us. What do I mean when I say health equity? I mean health for every single person everywhere. That means regardless of your zip code, regardless of how rural your neighborhood is, regardless of the income of your community, we are talking about advancing health for every single person. And so when we think about transportation and health equity, we're thinking about how do transportation decisions impact health regardless of where you live in this country. So as I unpack a little bit of transportation and health equity, building on what Megan presented for us, I want to just remind us of some of the ways that we think about health equity in the context of communities and transportation. First, we know there's a lot of evidence out there showing us that under-resourced communities have less opportunities for physical activity, increased risk of traffic crashes and fatalities, increased air pollution, and increased greenhouse gas emissions. There is an abundance of evidence, of facts, of science showing these impacts, and that these impacts are more likely to be seen in communities that don't have a lot of resources. That's a health equity issue. We also know that some neighborhoods in this country have limited transportation options due to a lot of policies that have been implemented even decades ago. We can think about policies like redlining that said individuals of certain backgrounds can't live in certain communities. We know that some neighborhoods, some cities have highways to quote unquote nowhere. We can think about a number of communities, particularly under-resourced, where you often have people of color living, where there are highways that have been developed, implemented, placed in communities that are separating those communities and making it harder to access resources and goods. We also know that there are disparities in terms of rates of people who are dying while walking on the street, while bicycling, again, looking at differences in communities and neighborhoods. And this is not just an issue affecting urban areas. I've had the privilege of working on areas in some rural parts of the US. Sidewalks are not present in many communities, regardless of where you are. And so when you think about people walking and biking on streets without dedicated lanes, that's an issue that also affects people who live in rural America. We know that these transportation barriers create challenges consistently and reliably accessing healthcare, jobs, schools, et cetera. And Megan just presented some data showing that. So again, transportation is critical for health. And as we think about the goal of making everybody as healthy as possible, we have to think about how transportation actually contributes to some of those inequities. So you might be asking, how do we achieve health equity? Well, there's lots of strategies. One is, as public health, we talk about working upstream as opposed to downstream. What do I mean by that? I mean by looking at more of those factors that cause those problems and not waiting till we see the disparities on the back end or the illness, really focused on prevention. We also focus on addressing those structural drivers of health or social determinants of health or the root causes. I started earlier by talking about the importance of sectors affecting health. Let's look at those decisions, those structural drivers that are coming out of decisions in transportation and trying to address those to keep people safe and healthy while they travel. We also know it's important to engage with community, talking to community members, having conversations, hearing from them about the solutions that they think will help to address these issues. That's one strategy that's critical whenever we talk about health equity. Similarly, or related to that, is promoting civic engagement, getting people involved, getting them to engage with their decision makers and policymakers so that they hear from them, so that they're talking about the importance of health in the decisions that are made, whether it's by the transportation department or by the local or state level or by other decision makers. We also know that there's an opportunity to change dominant narratives. So what do I mean by that? I mean that we all should recognize that these sectors affect health. And that's something that we shouldn't be afraid to talk about. How do we change the narrative that health equity is for all of us, not just for certain individuals? And then we can change policies and systems. I chair Department of Health Policy and Management, and this is where I focus a lot of my time and where I'll focus the rest of my comments today. Well, how do we do that? One way to do that is through a framework or a lens called health in all policies. Have people heard of health in all policies? I know some have. Yes, we're hearing some cheers from over here from our colleague from EPHA. So health in all policies, or it's called actually HIAP, you might hear that phrase as well. So health in all policies has actually been very popular outside of the US for decades. And we can look at the US and see that health in all policies has really become quite popular in the US in the last few decades. And this framework recognizes that we can change decisions, change systems, change how we approach decisions in these other sectors to center health intentionally. And so when we look at HIAP, and I've had the privilege of studying health in all policies, we see these are the key elements. First of all, these strategies promote health considerations, promote equity, promote sustainability in an intentional way. Health in all policies also brings sectors together, brings agencies together. There's a great example in Baltimore where a prior health commissioner created something called the Cross-Agency Health Task Force and brought together leaders from all of the city agencies with the health department to talk about ways that decisions that were being made in their sectors could be more intentional and promote health and not harm health. Also acknowledge the importance of creating co-benefits for multiple partners in health and all policies, so decisions are benefiting both the transportation sector and the health sector. We also know that there is a broad array of stakeholders that are brought together when we're looking at health and all policies, including community. And then opportunities to create structural and process change. This isn't a one-off. Health and all policies is about changing our practice, changing the way that we approach decisions. And we also know that this approach relies on data. So using data from various sectors to say, how do we amplify health? How do we identify opportunities for health decisions? So there's a number of tools out there to achieve health in all policies. I like to tell my students there's no single way to do health in all policies. Here I'm presenting a number of strategies, again, cross-sector government structures. You can integrate health planning into zoning updates, for example. You update a zoning code in a community. We can be intentional about saying, how do we think about health here? We also have seen examples of having health considerations when we have requests for funding proposals, or using tools such as health impact assessments. And I do a lot of work on health impact assessments. And if you've heard of HIA or health impact assessments, it's a structured process to say, before we make the decision, how will health be impacted? It's not an academic exercise. It is developing pragmatic strategies to change that decision that's occurring outside of the health sector. If you're interested in learning about health impact assessments, especially for transportation, I encourage you to go to this website. This is communitycommons.org. There is a repository there of health impact assessments that have been conducted in the US. There are hundreds there. You can search by sector, you can search by state, you can search by locality, and you can see how HIAs have incorporated health in decisions made by local transportation departments, state transportation departments, to be intentional about centering health. So you might be saying, Keshia, this is great. How do we do this? Why aren't we doing more of this? Well, there are some barriers I just want to acknowledge. The first is that public health folks aren't always the best at communicating, and so I'd like to say that sometimes we don't speak the same language with our public health, with our transportation colleagues. And so I'd like to lift up that one barrier is that we don't always speak the same language. Another barrier is around a tendency sometimes to be a bit more rigid. I have a picture of a slinky here, and just to reflect the need to be more flexible. And then finally, we still oftentimes work in our silos. So how do we get out of our silos in a way that's intentional? Health and all policies can help to achieve that. On the legislative side, I created a tool a few years ago building on the health impact assessment concept called a legislative health note. So for all of you who've engaged in the policy process, you're familiar with fiscal notes. Well, we created a tool called the health note to do something very similar. So when a bill is proposed, you can do the fiscal analysis and say this is what it'll cost. We do a health analysis. And in doing a health analysis, we are working with states to look at decisions outside of the health sector to say, when that bill comes forward, let's analyze it for how health can be centered. So we're doing that for transportation committees, for education committees, for committees where health is not always at the table. So I encourage you to take a look at this. We did a pilot of this work. Of course, we evaluated it. Bottom line, it works. People receive it. They think it's a really great way of getting science and evidence into the process. And we've partnered with entities in California, North Carolina, Ohio, and right here in Washington, D.C. with the City Council to really look at how we can bring health into bills. So I'll wrap up by saying that part of what we want to focus on, or what I wanted to convey today, is that health in all policies is a great strategy to bring health into transportation decisions. We know it can help to effectively bring sectors together. In advancing considerations related to health and health equity, I also think it's important to acknowledge why we got to where we are by looking at the history and context of some decisions. We also have an opportunity to engage community in a way that is authentic and inclusive. And finally, again, we want to work with communities and not on communities. So thanks for your time. I appreciate that, and thank you. I look forward to questions at the time.
Thank you, Keshia. That was a great presentation. If you need more pita bread or more marinated mushrooms, this would be a good time to do that, because I have a couple things, and then we'll get to our next one. When you said fiscal note, Keshia, that put me back in Annapolis, because that's a very Annapolis way to, maybe other states do them too, but if you're in state government in Maryland, fiscal notes. Also wanted to just mention, like, the access point is so important. We live in Prince George's County in Maryland, and we're getting a hardware store within walking distance, and my year has been made. The idea that I can just go get stuff and not have to drive through the parking lots is so exciting. So, very excited about that. Keshia's slides, Megan's slides, I think Jacob's and Benito's will be the same way. Lots of great information. If you haven't already picked up a printed copy, they're on the front table. But all of the presentation materials are available online. So make sure you download those. Lots of great statistics and citations in all of these slides. And there's time for questions at the end of our presentation. So if you're in the audience, stay tuned, stay seated. If you're in our online audience, you can send us a question. And the email address to use is ask, that's ASK, at EESI.org. And thanks to those who've already submitted questions. Really appreciate that. All right, that brings us to our third panelist of the day, Jacob Miller. Jacob is the Senior Project Manager, Jacob is the Senior Project Manager at the Smart Surfaces Coalition, where he manages the Coalition Cities for Smart Surfaces program. Jacob is a certified energy manager and has worked as a materials scientist, policy researcher, journalist, and community organizer. He spent the last decade focused on identifying and implementing solutions to the climate crisis. With Smart Surfaces Coalition, he works with a wide array of experts to help city staff and community groups increase the presence of solar reflective, permeable, and vegetated surfaces in their cities to create a more resilient urban environment. Jacob, welcome to the lectern. I'll turn it over to you.
Excellent. Thank you so much for inviting me here. Thank you to EESI, APHA, Shweta for the specific invite, and Transportation for America. Really glad to be part of this panel. My name is Jacob Miller. I'm, as Dan mentioned, I'm the Senior Project Manager for Smart Surfaces Coalition. And first, I'd love to tell you just a little bit about our organization. Smart Surfaces Coalition is a nonprofit coalition made up of more than 40 organizations that support cities in their efforts to become cooler and healthier and more resilient. So as a coalition, we bring together public health experts, meteorological modelers, policy wonks, material manufacturers, GIS experts, urban foresters, and experts from many other sectors as well to help cities manage the problem of extreme heat and stormwater flooding, specifically through the transformation of their surface infrastructure towards what we call smart surfaces. This is a framework that we came up with at the coalition. So what are smart surfaces? This is a term that describes infrastructure strategies that cost-effectively manage urban heat, cost-effectively manage stormwater, while maximizing the public health, climate, and equity co-benefits that come with each of these technologies. So smart surfaces can include reflective surfaces. You might be familiar with cool roofs and cool pavement coatings. These can help reduce urban heat island by reflecting more solar energy out of the city. Green surfaces, such as urban trees, green stormwater infrastructure, green roofs, all of which help improve air and water quality. They provide shade, reduce water flooding again. Permeable paved surfaces like interlocking pavers, porous concretes, to help stormwater management where paving is necessary. We also consider solar panels and low, zero, and negative carbon concrete to be smart surfaces because they help cities decarbonize and even in certain applications can help cool the urban environment. And so together, all of these surfaces make up this smart surfaces framework. And as a coalition, it's our mission to make smart surfaces the urban design norm within a decade. Because these are common sense strategies. They make cities cooler, they make them healthier, they make them safer, And they save money on health costs, maintenance costs, they reduce energy consumption, and generally are just making urban environments more livable. And I want to bring us back now to the core topic of today, which is surface transportation infrastructure. They can play a really key role in that space. So I just want to highlight a couple of examples here. So as you can see on the left, we have a retrofitted intersection that incorporates green stormwater infrastructure. It's a pretty simple solution that enables us to slow traffic, make the city cooler, manage stormwater, all at once, getting $5, $6, $7 worth of benefits for a single dollar spent, when we might, in other cases, just be putting pavement there, right? So this is really a cost-saving measure that also enables us to deliver direct public health benefits through air quality improvements, water quality improvements, cooling. On the right-hand side, we also see a solar reflective pavement coating. This is in LA. And these coatings are able to reflect more sun, as I mentioned earlier, cooling the city, both the surface temperature of the pavement, which can get up well above 100 degrees Fahrenheit, and reducing air temperatures, making it more comfortable for pedestrians. This heat mitigation feature is so critical because heat is the deadliest weather event in the world, and so implementing these strategies are really critical from a public health standpoint, specifically for urban heat island. Then you also have, with the pavement coatings especially, these maintenance cost benefits. So reducing the surface temperature of the pavement can actually help prevent cracking and buckling. So you're getting, a longer, greater longevity from your pavement. So a lot of benefits there. And these are just a couple of examples. I want to highlight a few more here, and ways that we can integrate these surface types into infrastructure we're using all the time, right? These are small tweaks that we can make that can make our surfaces 5 to 10 times more valuable to our cities than they currently are. So we have here curb bump outs, again, for reducing traffic speeds that are also managing stormwater. We have bus lane coatings, so conventional bus lane coatings, typical like pavement paint. You can actually put in a solar reflective version of that, making the pavement coating more visible, while also reducing urban heat island again. There are permeable pavers that you can use in the roads, in intersections. Like you see here in the top right, they can manage pretty standard traffic loads and also a ton of stormwater infiltration, and so you get a huge benefit there. We can be putting green stormwater infrastructure in our traffic calming circles rather than just paving right over them. In Boston, for example, they are putting green roofs on their bus shelters. So not only we can use smart surfaces not only to provide traffic safety benefits, but also to protect our public transit users. So there's a ton of opportunity here, and again, I really want to emphasize these are cost-effective, well-understood solutions that we can and should be implementing all the time as our baseline design norm. So each of those strategies I mentioned is sort of in isolation, but when we bring those surface infrastructure strategies together, we can generate some really, really amazing benefits. What you're seeing here on the screen is a snapshot of meteorological modeling that we did with our partner at Altostratus Incorporated that shows that the implementation of reflective surfaces and increased tree canopy and vegetation, so cool roofs, cool roads, can deliver up to 7.5 degrees Fahrenheit of cooling on a hot day, like a hot summer day. And this is based on, 500-meter resolution modeling. At the like neighborhood scale and at the individual scale, these benefits can be greater. And so this is a really critical part of thinking about how surface transportation infrastructure can affect public health, because not only can we protect people from extreme heat, but we can also encourage active transportation by making our cities cooler, making it more pleasant to walk and to bike. So part of what we're doing at Smart Surfaces Coalition is thinking about how do we make this vision of cooler cities, smart surface cities, a reality. So in 2023, the coalition launched our Cities for Smart Surfaces program. This is a technical assistance program that supports city staff and community-based organizations in their efforts to implement these various smart surface infrastructure strategies through projects and policies and plans. You can see we have 10 cities that are part of the program. It's our Smile Across America. We do analysis for the larger metro areas as well, so some of that meteorological modeling that you saw on the previous slide. We have that available for all 10 of these cities and metro areas. We're supporting them with benefit cost analysis. We support grant applications, policy implementation, all to help cities achieve their goals of becoming cooler and healthier. I want to highlight just a couple of examples from cities that are participating in this program that I think are pretty exciting. The first is some design standards in the city of Boston that actually require that all curb extensions are using green infrastructure alternatives in place of impervious materials. So that means incorporating things like rain gardens and bioswales in the public right-of-way, using tree trenches, porous paving. And this is what's really great about this approach is that it is integrated into design, right? So we're making sure that every project is implementing these solutions, and that's how we capture those benefits, both financially and health-wise and temperature and the cooling benefit. And that program's been really successful, so they are expanding and working on incorporating these green infrastructure requirements into all streets projects. So really accelerating the city's ability to manage its stormwater, reduce outdoor air temperatures, and encourage active transportation in the process. In the city of Phoenix, they recently released a shade plan. It's sort of a first-of-its-kind plan that sets guidelines and targets for increasing shade across the city, both through expanded green infrastructure like tree canopy, but also making sure that there are bus shelters at all feasible bus stops, incorporating pedestrian shade structures along heavily trafficked public rights-of-way, and generally putting in more green stormwater infrastructure. And you know, these solutions are really interesting because again, I think the shade policy especially highlights that not only can you use smart surface strategies to address public health by encouraging active transportation, but you know, take the bus shelters for example, we can also use it to protect our users of public transit, to reduce temperatures at transit stops, and in the process we're also both in Boston and Phoenix and many of the cities we're working with to make our streets safer too, right? Like the incidents from traffic, as we heard, are really substantial. That in and of itself is a public health crisis, and so traffic safety and the benefits towards traffic safety from smart surfaces is another way that we can achieve those public health benefits. And there are a lot more policies and examples from across the country that I would love to highlight. Of course, we don't have time for that, but I want to share some resources so that you can access that, so that you can stay connected with our coalition and get these updates. The first thing I'll highlight is our Cool Roadways partnership. And this is a cohort that is focused on the implementation of cool pavement specifically, so those pavement coatings that I mentioned. It brings together more than 25 cities, sharing progress and learning about current projects and programs in the cool pavement space. This is really like the premier place to learn about cool pavements, so if you're interested in participating, let me know and I can get you connected. The second thing I want to highlight is our peer learning network. This goes beyond cool pavements. This was designed to share the lessons and resources from the larger Cities for Smart Surfaces program. And so our next session is May 8th if you'd like to participate. I will leave the QR code up for a second, but I think it's also in your slides if you're interested in signing up. And this has already proven to be a really exciting space. I think we've got more than 60 cities represented, and a lot of folks are really excited about implementing smart surfaces more broadly. I want to very briefly highlight some great work that's happening already at the federal level. The first is a bill that was introduced by Senators Markey and Gallego, which would create a HUD grant program for local governments, MPOs, tribal governments, and nonprofits to implement urban heat island mitigation measures, such as smart surfaces like cool roofs, cool pavements, tree canopy. And the second is the Cool Roof Rebate Act, which is designed to help lower the cost of the high-performance reflective roofing materials. That helps reduce energy costs and reduce urban heat island. And again, cool roofs represent, we don't think of them as traditional surface transportation infrastructure, but they represent one of the largest ways to cool outdoor air temperatures, right? And so they are, in that, are a way to encourage active transportation. And finally, I just have some links up here from some of our partners and colleagues. These are a lot of great resources. I think the links will be available through EESI. Please come chat with me if you want to hear more about any of these. And with that, I will wrap up. Just thank you again for your time and attention, and it's a real pleasure to be here. Looking forward to your questions.
Thanks, Jacob. Your smile across America is more of a smirk because it has like a lot of like Southeast concentration, but that's okay. We've done a lot of resources on a lot of the topics that Jacob was just talking about. For example, we've done briefings on nature-based solutions and natural climate solutions, including urban tree canopies. And we have a briefing coming up, I want to say it's in June, on extreme heat specifically. So we'll have some really good resources coming online. Won't necessarily be transportation focused, but on some of those things. So thanks for that great presentation. That brings us to our fourth panelist of today. Benito Pérez is the Policy Director at Transportation for America. You might remember Benito. He was with us a couple weeks ago at our 4th Congressional Climate Camp. And so if you want to learn a little bit more about what he had to say in that context, check it out. He's a repeat customer. Benito previously served in various roles at the DC Department of Transportation, focused on curbside management and operations for transportation policy. Prior to DDOT or DDOT, he was a transportation engineer with the Hampton Roads Transportation Planning Organization, working on long-range transportation planning and its intersection with active transportation and land use. And in addition, he previously worked on the Maryland State Highway Administration, working on equity and inclusion issues in transportation. Benito, once again, welcome to an EESI briefing, and thanks again for Transportation for America's partnership, along with our friends at the American Public Health Association.
Good afternoon. Good afternoon. All right. Well, thank you for joining me this afternoon. And I'm going to kind of wrap up the conversation on more the high level of policy and funding to advance public health and transportation. And Transportation for America is part of Smart Growth America, and our North Star is focused on, doesn't matter who you are, where you live, you should be able to live in a community that's healthy, prosperous, and resilient. And we do that through our 3-point impact model. And then within Transportation for America, we have our 3-point principle on fix it first, stay to repair, and invest in the rest. Before I start my conversation, if you were here a month ago, you probably saw the same question, and I hope you take this question away as you think about the next reauthorization bill, is who are we doing this for? And it's related to your presentation earlier, the crazy interchange, but this one's in another part of the world. But who are we doing this for? Is it for vehicles or for people? And thinking about people not as a monolithic idea, but thinking about people that are aging in place, people with disabilities, children playing on our streets, and those historically marginalized from mobility access. And they belong to a diversity of communities around the country. No two communities are the same. You have your New Yorks, you have your Wheeling, West Virginia, Aspen, Colorado, Oxford, Mississippi, etc. No two communities are the same. I want to reflect now on where we've been when it comes to reauthorization. And I'm just only going to go back to ICE-T, Intermodal Surface Transportation Equity Act, I think it was, in 1991. So we're talking about a little over 30 years of history. We've spent about $1.5 trillion in surface transportation funding. And yet, you ask yourself, what are the goals of the program? We've set goals along the way, and the most recent time we set goals was in 2012 during MAP 21. We talked about safety, state of repair, congestion relief, system reliability, environmental sustainability, streamlined project delivery, and economic vitality. But yet, have we actually made any progress on those goals? I would venture to say no. Our roadway fatalities continue to go up. We have worsening congestion. worsening reliability of our system. So it begs the question, what's going on? And some of it has to do with some of our goals. We have performance metrics that we've set, and some of them make no sense. Let's pick on safety for a second. There's no rule or statute that prohibits a state from setting negative safety targets, meaning I could be state X and say last year we lost 300 people on our roadways. But next year I'm going to set a goal of 400 because, population's growing. And we allowed that to be acceptable. That could be someone's, relative in the room, so your coworker. How are we allowing the Federal Transportation Program to allow negative safety targets? And some other goals, we establish a metric, then we repeal it, we set it, we repeal it. And the overall theme I want to say there is there's been limited accountability to these goals that we've set. And we need to get serious with our goals. If these are the 7 goals that we set in 2012, if these are the goals of the program, then we need to actually have accountable measures to address our transportation program and stick with them and, hold our funding recipients accountable. Now, looking more recently with the Infrastructure Investment and Jobs Act, which passed a little over 3 years ago, there were some benefits from it. It increased local funding access. It created a variety of new programs, which I'll get into in a moment. And it also provided a generational investment in surface transportation that we haven't seen in a while. However, one of the challenges there was we overwhelmed the capacity of not only USDOT, but our local and state partners in receiving that funding. We weren't thinking about the capacity. It was great that we got the resources, but we didn't think about on the receiving end, did we have the capacity to receive that funding and implement it in an effective way? And then also there was a disconnect of the policies with the outcomes. This bill was talked about as a climate bill. And yet through some of our analysis at Transportation for America, our Fueling the Crisis report, the investments that we set out in IJA are not yielding those outcomes. We're actually seeing investments that are increasing emissions. So there's a disconnect in what we say we're trying to do, and we're getting different outcomes. So some of the other policy changes that were positive, we created programs to help advance active transportation. We had the Safe Streets Road for All. We had the Active Transportation Infrastructure Investment Program, Carbon Reduction Program, Reconnecting Communities Program, and Protect. The challenge, though, with these programs, they're very beneficial, but however, they're only just a small piece of the puzzle. And they have specific eligibility, specific ways that they have to be managed, and yet we're not addressing the overall scope of the program. And in addition to that, the federal formula funds, that we allow flexibility for our states to address that, yet we are very stringent with those dedicated funding for the programs I just alluded to earlier. And all we're doing at the end of the day is empowering our states and localities with a hand shovel while that backhoe is continuing to dig a bigger hole to our problems. There's been other recent policy changes from IJA. USDOT adopted a safe system approach. It's their version of a Vision Zero policy. And we saw some of that trickle into the manual uniform traffic control devices, which I want to stipulate that this is a guidance document. This is not a rules document, even though some of our partners at states and localities think it is, but it is a guidance document that helps guide consistency in how we mark and sign our transportation system. What it did was move the needle towards thinking about people first, though there's still that vehicle culture still within it. So there's still ways to go. There's going to be some cultural change that will need to happen in future iterations to really think about that people first mindset in our guidance. So now looking ahead, what we can do in the next reauthorization when it comes to health. We've talked about this before. Keshia talked about the silo issue. It perpetuates our livability issues. And if you didn't know, in the infrastructure law, there was a provision in state and metropolitan transportation planning that allowed for more holistic planning across land use and housing. But the wording was should consider. There was no mandate. So for some jurisdictions, some states, some MPOs, they considered it and incorporated it into their practice, and others were like, we considered it, and we're just going back to status quo. So if we're serious on tackling some of these issues, we need to put some stronger language. That could be simply change the word from should to shall. And also adding health into the conversation too. So shall consider health, land use, housing, and transportation decision-making. Also, we need to think about investing in the rest of our transportation system. We've talked about creating a lot of these new discretionary programs that could also overwhelm DOT in our localities. We need to find ways to create these as like formula programs, but that are locally accessible, such as like Safe Streets Road for All. One thing that's been a challenge over the years is the issue of streetscape accessibility. And it's something that is in an eligibility within Safe Streets Road for All, but further enhancing that eligibility so that communities that are running through challenges and addressing their ADA compliance can use that resource to address those gaps. And also, I'm going to move ahead here for the sake of time. We also want, beyond reauthorization, there's an opportunity to intersect our transportation mindset in the health space and thinking about behavior change. And I want to encourage you all to take a look at the State Physical Activity and Nutrition Program and the Active People Healthy Nation Program. These are focusing on educating and creating exposure and acceptance to active transportation, saying it's okay to bike, it's okay to walk, allow your kids to walk to school, bike to school. It's also providing resources that states and localities can leverage with their own money to build active transportation infrastructure, and also building that capacity for not only our practitioners, but our elected officials to think about the policies and investments to yield those outcomes. And I want to wrap up on some policy opportunities when we think about reauthorization. I've talked about that vehicles versus people first. There's opportunities I would encourage you to sprinkle within, reauthorization language to that effect. And one of those things could be thinking about community-driven and people-oriented speed limits and road design. Because the roadway safety crisis will, sometimes point to driver behavior. We'll talk about the larger vehicle sizes, and they contribute to it. But that one part that doesn't get talked about enough is our roadway design. And there's some other approaches here as well. One thing I'll also highlight within this list here is repealing the value of time or significantly reform it. And you're like, what is that? So value of time is premised on our practitioners in transportation. They try to translate time into money, how much time it takes for the vehicle to navigate the system. Of course, the car is going to win that argument, and it disadvantages biking, walking, transit. So it discourages decision makers to make those investments. So it's disenfranchising those that want to walk, bike, and take transit. So we need to significantly rethink that measure in our transportation decision-making process, or outright just get rid of the measure altogether. And as I alluded to earlier, we need to also think about disallowing negative safety targets. We should not think one more death is acceptable. So there's other bills that start to tackle those things, and you can probably look at them from the 118th Congress, between the Lincoln Camp Bill, the Complete Streets Act from Senator Markey, Building Safer Streets Act from Senator Fetterman, and also Senator Markey's Green Streets Act. And one last thing I'll point here is this might be also an opportunity, going back to those 7 goals I alluded to. Take a look at them. Are they still the goals that we need today? And what are the appropriate metrics? Do we need to add one for health performance? So some additional resources real quick for the sake of time. I've alluded to this before about our roadways are dangerous by design. This goes into more in depth on that narrative. And then for those that are interested in rural America, this is our active roadmap. This talks about the challenges, opportunities, and policy recommendations on improving rural mobility, noting that a third of Americans, especially in rural America, Americans in rural America, don't have access to or don't have the ability to operate a vehicle. We have this community connectors portal, which could be a useful resource to answer the question: what is value of time? And there's some other resources from our friends and partners in this space, American Heart Association, Trust for Public Health, among others. And it was alluded to in earlier remarks about the intersection between transportation and food access, healthcare access, the social isolation epidemic. And this is how you can reach out to us if you want to dive a little further, if something sparked your interest in today's briefing or something related to surface transportation. We're happy to come meet with you and get into the weeds. With that, I think I'll yield back for questions. Thank you. Thank you.
Thank you very much. I'm glad you defined value of time, because if you had said, what's the value of time, I would have guessed it was a Doctor Who episode plot. That sounds like it's something like very 70s British television. Thank you, Benito. Reminder, all of the presentation materials are online. If you'd like to go back and revisit any of the presentations, you can certainly do that. That was a great set of presentations. Thank you to those in the online audience who are sending in questions. We are going to turn to our in-person audience in just a moment, but to kick us off, Megan, it's been a little while since we've heard from you, and so I'll pose this question to you first and then invite Keshia and Jacob and Benito to weigh in. Outside of what we're talking about today, which is this idea of surface transportation reauthorization and the process leading up to that whenever it happens, outside of that, how else could transportation and infrastructure-focused congressional staff people think about health considerations and incorporate that into what their bosses are working on and thinking about in this space?
Great question. Maybe a plug. So at Hopkins, we have a Bloomberg American Health Initiative that allows people from other sectors outside of public health to come get an MPH, Masters of Public Health. And part of who they're targeting are people working on the built environment. So it's a free degree, and it connects you with this huge network of people working to connect public health and transportation. But there's also sort of a lot of organizations like yours and APHA and who are working on this, and I think you all have a lot of resources. I'm going to pause there and let everybody else answer, but I also have other ideas too.
Right, we're a plug-friendly environment, as you've already heard. Keshia, I'm curious to hear from you. What other opportunities are out there to incorporate some of these ideas into policy development?
Yeah, I want to begin by echoing Megan's comments about education and opportunities for training and capacity building. And then I'll go back to what I talked about today is, again, being intentional about these opportunities to bring transportation together with health. And so we think about, Benito mentioned complete streets policies. So if you think about efforts to change a built environment or redesign a community, there are ways that we can work together with our health partners to say, how can we promote health in these decisions? How can we minimize the harms? And so again, sometimes just getting together with people outside of the sector, Dan, and I think that that's really critical. So that's just one other example I want to lift up. Thanks.
Jacob?
Sure. One thing I would highlight specifically is going back to the cool pavement technologies that I mentioned. Of the smart surface solutions that we look at, this is probably the newest. And I think what we would really benefit from as an industry and as a space is comprehensive research comparing the different technologies so that they can be implemented more effectively and so we can understand the differences between them. There are some technologies that are more like reflectance-based and focused on urban heat island. There are other technologies that help improve air quality by getting rid of air pollutants. And so I think that's something that could be done at the federal level is more research there, like sort of third-party analysis.
Great, thank you. And Benito, I'll pose the same question to you.
Sure. So from my perspective, I'm the transportation engineer and planner. So I would think about, from your perspective, if you, as the legislative aid on transportation, is thinking about those built environment touch points and talk to your colleagues within your office, but other offices as well, because some of this might be other committee jurisdiction. Which then goes into the issue of some of the funding that can tackle some of these issues are spread across various federal agencies, various committee jurisdiction, and we need to find ways to streamline, commingle that funding so it's simpler for the practitioners on the ground to get things done. Because if I have to worry about, when it comes to like public transportation access, for example, we know Federal Transit Administration is the big recipient of funding, but then there's Veteran Affairs, Health and Human Services, Department of Defense, among others. And the transit provider has to think about like, okay, well, here's the requirements for agency A, B, C, D, and they're spending more time on the administrative side of things versus service delivery. And I'm sure it's the same thing about, cool pavements. There might be stuff from DOT and HUD, among other things. Can we find ways to commingle those funding? And then lastly, to that effect, is technical assistance in providing integrated access to health data and transportation, because some of those practitioners, especially state, local, metropolitan planning organizations, may not have the access like right there. So having that pointing to those data points, the technical assistance they can get to, so they can incorporate health in all policies in their work.
Great, thanks. Oh, go ahead, Megan.
Just a couple things. Sorry, I love that, Benito. I think like an interagency working group that brings all those agencies together to coordinate or to talk to each other would be fantastic. And then I think Keshia had talked about like health in all policies. Some states have required health impact assessments for any, before, I mean, at the national level, we have NEPA, which demands environmental impact assessments. So, instead of just doing an assessment of what this policy change is going to do to the environment, asking what this is going to do to health, and maybe even go a step beyond, which is cumulative impact assessment that looks at what is this going to mean to health and what is this community already facing when it comes to everything else that's going on in the community.
Great, thanks. All right, we will turn to our in-person audience if anyone has any questions. Oh, we've got a question right there in the middle. Wait for the mic so that the live cast can pick you up.
Hi, I'm Sean. So one of my big career goals is to get involved with pushing for high-speed rail across California. So my question for the entire panel is just, what are your thoughts on high-speed rail initiatives in terms of how they impact and affect access to resources like health, environment, and economic benefits, while keeping in mind some of the impacts that Keshia talked about, like community separation, displacement, gentrification, and stuff like that?
Great. Thanks for your question. We'll open that up to anyone who'd like to weigh in.
I'll jump in. I think, let me make sure I understood your question, is thoughts on high-speed rail as it relates to like the health and transportation in communities. Let's see, how do I go about this? Let me just treat rail as a fundamental, like whether high-speed rail or conventional rail that we have in the United States. One thing that it provides is the inner-city connectivity to jobs, to healthcare. And I think when we think about the next surface transportation reauthorization is to look at our existing system and how do we strengthen our foundation so that in some future we can think about enhancing our foundation to high-speed rail. Because there's some parts of the country that have intermittent passenger rail service, and it is a lifeline for their communities. I think it's Ruston, Louisiana, that has a school for the blind, and they rely on passenger rail service or to get there. And I know they're talking about developing a corridor, the I-20 corridor, so they can have improved connectivity to other communities for culture, for jobs, and healthcare. So so to your point, I care about high-speed rail too, but I also would stress let's focus on the foundational system first, because that's providing a lifeline to a lot of communities.
Great, thanks. Jacob, Keshia, Megan, do you have any commentary you'd like to add to that, please? It's totally okay. I'm just asking. Want to make sure we get a chance. Okay, great, thanks. One thing, actually, building on his question is we talked a little bit about it, but like the connectivity, right? Like, walking to rail stations, driving to rail stations. If you drive to a train and then you take a train somewhere, that's, I would think, probably better for health outcomes than just if you stay in your car the whole time. And so that nexus of like, how do you move from, the sidewalk to the car, to the, all of that is something that, I mean, I think about that because I drive to a metro station and then I metro and then I walk and then I reverse it on the way home. So Megan, it sounded like, looked like you.
They call it the last mile, you know, so it's, yeah, and I think rail in general is awesome. I'm a huge supporter of rail just because it's getting people out of their cars, it's maybe getting us more social, it's reducing air pollution, it's reducing greenhouse gases. There's, you know, I think there's a lot of, one other sort of maybe related, but related to everything we've been talking about is data, like access to data. I think Benito maybe just touched on this recently, but you know, like being able to assess like how accessible is transportation, how many people live near a rail station, how fast does it get them where they want to go, who's using it, like all of this data needs to be tracked by somebody, and so I think that's really important.
Great, thanks. Did you have something, Keshia?
Yeah, I was going to just amplify the point Megan made around the data and about the importance of bringing individuals together from different sectors who might be responsible for different aspects of those data, right? And I think, Benito, you talked about sort of jurisdiction in terms of like one agency having some data, right, that somebody else doesn't have. And I think it just gives more support for coming together to be looking at crashes, looking at safety, looking at density, a number of different variables, and really pulling together different databases. It's just critical for this work as well.
Great, thanks. And Sean, since you said your name, I'm going to call you out. I better see you at these rail and transit briefings coming up. I'm very good with faces and names. I will absolutely be very disappointed if you're not with us. But seriously, you'll really enjoy those briefings. It looks like we have a bunch of questions.
Can
Let's
I
go.
jump? Sorry, can I jump in on?
Oh, go ahead, sir, Benito. Go
Sorry.
ahead, please.
The one opportunity with this, to your question, it does open up the conversation, especially a bipartisan conversation on thinking about active transportation, public transit, especially a lot of those communities along the national network. So, especially like, for example, the Gulf Coast region, we're working a lot with them down there. They're about to open one of the first in a while new service for Amtrak from New Orleans to Mobile, and that's opening up the conversation to your point. Okay, once I get off the train in Mobile, how do I move around? Or Bay St. Louis, how do I move around? So it's having decision makers now starting to think about that question. So it opens up an opportunity to address some of the issues we've been talking about.
Great. All right, a bunch of hands went up. I'm going to go in the order that I saw them. I think that means you first, and then you, sir, and then we'll go to the back of the room, and then we'll go to the back of the room. So we may go a couple minutes over. Please consider that as you think about the brevity of your question framing.
That's unfortunate. Mine was a little long, but I will speak quickly. So with the recent rifts and reorganization happening among various federal agencies, do you foresee potential impacts on collaboration, specifically among public health and transportation sectors and the work to advance health equity? And then if so, what are your thoughts around this or suggested strategies to really support that collaboration still?
Thank you. We'll open that up to the group. Any commentary on that one? Go ahead, Benito.
Sure. I'll highlight one example that's coming to mind that's a concern for our organization, crash data, for example. There was a memo from NHTSA yesterday, I think it was yesterday or the day before, that flagged, excuse me, that the 2023 data will be finalized in 2026, and then preliminary 2024 data will be released then as well. That impacts decision-making downstream. Once upon a time, that data from initial release to finalize was 9 to 11 months. Now we're at 24 to 30 months. And that's I can only presume it's going to get longer as a result of staff being removed, because there's, the need to receive the data, analyze the data, quality control the data. And if those people aren't there, you're just going to slow down, if not stop the entire process. And that'll have detrimental impacts to some of the decision making that states need to make based on those trends and patterns.
Thanks.
And maybe health data. I just want to lift up health data as well. I mean, certainly the crash data is really important. Today we've talked about physical activity, we've talked about walking, a number of different metrics, and I'm wondering, how are we going to get those data? How long will it take to come? Who's monitoring the data? And I think that those are real questions that we have, particularly how do we move the work forward? And when it might be harder to get those data.
Great, thank you. Thanks for the question. We'll go to you in the second row. Thanks.
Thank you all so much for your time and the great presentations and your expertise. I think one thing, like when we talk about reordering our transportation hierarchy to prioritize people over cars, I find it frustrating that it has so many benefits. You can talk about the economic, the environmental, the social benefits, the public health benefits. So it just seems like a no-brainer. So I'm wondering like where you guys are meeting resistance to this message and how maybe you're addressing it.
All right, Megan, your hand went right to the microphone, so you'll get to go
I think
first.
about
Thanks.
this all the time. I mean, cars are convenient, right? America wants everything fast. You know, we want things big. We want, you know, and we want to be free. We want to make, you know, if we want to drive somewhere, you know, we want to drive somewhere. And so I just think it's part of our culture. And so I think if we are going to shift to more active transportation, I think it's going to have to be a cultural change. And that's why I think we need to change the environment to make the active choice the easier choice, because otherwise people are going to continue to make the same choice that they always have.
Thank you. Jacob, go ahead.
I mean, one thing that I think we see a lot of when working with city governments is that this siloing question is really, really critical. And I think the reason it's so critical is because part of the reason these interventions are beneficial and are cost effective is because you can spend $1 and get $5, $6, $7 worth of benefits. But if those benefits are spread across 6 different departments and folks are not understanding that a single dollar spent can help everyone achieve their goals more cost effectively, we don't get to implementation. And so making sure that those conversations are happening in an integrated way, like integration in my mind is the real key here, just having those conversations.
Great, thanks. Benito?
Sure. For me, a couple of points come to mind. One is the issue of legislative oversight. One thing is, from your angle here at federal level, a question I would ask, like, do you know how our federal transportation dollars are being spent across the states? Probably the answer is no, because states are required to deliver what's called a state transportation improvement program, and they're all written completely different in each state. So if you try to aggregate it to one number, it's not that simple. So there's no way to have like true accountability. Like, are we spending a certain way to yield a certain outcome? There's no way to do that right now. And that might be an opportunity for reauthorization, find some way to standardize that. And at the state level, that's also a challenge. They're, you know, under-resourced. You know, some legislators, I met with some last week from the Northeast. Some, I think half the room didn't have a staff member, and then some others maybe relied on one for like 10 legislators. So they can't keep up with, you know, transportation policy. So they defer a lot to the state DOT. So that creates a challenge for them to ask the questions like, are you delivering what the state needs? Which then in turn for the state DOT, change is hard. I'm used to, my mandate since the 1950s or even earlier is to build roads. And then I've integrated the mindset that the manual uniform traffic control devices is the rule. That's why I stressed earlier that it is guidance, it's not the rule. But some state DOTs think it's the rule, and if you deviate from it, you can get in trouble, lawsuits and whatnot. So that becomes also another issue that might be an opportunity for you all to address in reauthorization, is addressing the liability concerns state DOTs have to think outside the box.
Great, thanks.
And
Go ahead, Keshia.
just briefly, I wanted your comment, your question made me think about how the comment I made earlier about upstream versus downstream, right? And so we think about how are communities designed. I think about people I've talked to in community who say, I wish I didn't have to own a car because I have to take 2 buses to get to the supermarket to pick up food, or I can't get to work, or I can't get to healthcare in terms of how my community is designed. And so if we think about how are we designing communities up front to access some of these goods and services, can we do that and center people so that there's less reliance on having to have a car, and also increasing public transportation and making sure that we're doing that. To me, it's a multifaceted strategy, and we can think about being intentional up front to design communities in that way. And I think other sectors matter there too. Housing affordability is also an important issue here in terms of where people end up moving and where they live.
Great, thanks. Thanks for your question. And we actually got an online question that I think kind of builds on it a little bit. And this question has to do with kind of finding common ground around the benefits. And Sean, we'll see you in a couple weeks.
Send me a note, Sean, afterwards on the rail stuff as well.
Poor Sean, he didn't know what he was signing up for today. Finding common ground on curbing environmental effects. And it reminded me, and your question reminded me, Jacob, I think it was your presentation, you had the map of Dallas, and I think your slide said something like 7.5 degrees Fahrenheit cooler. How do you communicate the benefits effectively so that people who live in Dallas appreciate sort of where the solution came from, what the solution entails? Like 7.5 degrees is enough to notice, right? That's the difference between being 60 degrees and 67.5 degrees. That's noticeable. Or 80 and 87, there's a big difference. How do you communicate that though? Like how, and because my guess is that once you experience it, it becomes an even more of a no-brainer, right? Like it's better to be 90 degrees than it is to be 97 degrees. So Jacob, I'll open it up to the group, and thanks for the online question. It's not exactly what you asked, but it's close, and curious what you think.
I don't think there's a single solution here, but I do want to point to one initiative that I think is really cool and effective in this way. Kappa Strategies is an organization that's doing like a citizen science campaign where people go around and actually measure the temperature, the air temperature and surface temperatures in their neighborhoods and all across the city, and then they can see, firsthand how the built infrastructure is influencing their heat experience. And I think more than, talking about what could be, drawing attention to what is currently like status quo, which is that we have dark impervious surface infrastructure everywhere and very little vegetation, and pointing to the extreme heat we're experiencing from that infrastructure, I think helps people get an intuitive sense. And I think a lot of people do have this intuitive sense of like, when I'm walking down a tree-lined street, I feel a lot more comfortable. But I think I point to the Kappa Strategies work because I think getting people out there and participating in that effort and in that communication work is really critical so that they're, experiencing the story and they're telling the story themselves.
Yeah, like if you could generate support in Dallas and in Phoenix and in any of the other, Boston was one of the cities that you highlighted, and there were others. Everyone's the same. We all feel stuff, right? So, yeah. Go ahead, Keshia.
I was going to say, telling the story is such a critical point, right? What's the narrative we're telling, and how are we sharing how these temperatures are impacting somebody's lives, right? Does it mean my kid can't go outside and play today because it's harder to breathe? Or how are we actually taking the science, the numbers, and translating it in a way that resonates with people on the ground? And I think that we could do better, all of us, to really tell those stories and to connect with people and hear their stories and share those stories to help build that dominant narrative.
Great, thanks. Benito, go ahead.
Clear, simple, relatable, meet them where they are. Thinking about it from the road safety angle, I had a chance to talk to an organization called Peak in Michigan that works with people with cognitive disabilities, and they talk about roadway safety from just the simple binary: is this a mean road or a nice road? And so finding those opportunities to keep it simple, clear, relatable, and meeting folks where they are. And if you have the opportunity, or empowering our practitioners the opportunity to bring the community to be those messaging ambassadors as well.
Great, thanks. So we started a couple minutes late. I know two of you have to take trains home. So is it okay if we go a few minutes over? Because we had two other questions. We had a question in the back on this side, and then we had a question in the back on this side, and then I think we're going to have to call it. So just as long as we move quickly, I think we can try to get to as many as possible.
I just, for Keshia, and if I'm saying your name right, I apologize if I'm not. And if the answer is look online for this, that would be fine too. But I'm curious about how you do score bills for health impacts, and whether that also applies to scoring federal legislation and not just the more localized state and local bills. Thank you.
Yeah, thank you. It's Keshia, and there is something online, but I'll tell you, the short answer is also follow up with me. But so one of the things that we don't do, we don't score like CBO in terms of looking at the economic costs or sort of 10-year projections. But what we do is we have a methodology. We do a rapid literature review. We pull together, look at the pathways of how the bill will impact health. We also pull local data and pull that into our health notes. So very specific, context specific. And if there are cost data available, we'll pull it in and pull it into the analysis that we're translating and sharing. So we're not we're scoring the literature in terms of what's the strength of the associations based on the evidence, right? How likely is that bill to lead to that health outcome? Yeah, so we rate the strength of the evidence based on sort of a very strong, inconsistent, and so we use a qualitative assessment, and then we have a narrative summary in the text of the reports that are online. So if you search for legislative health note, Johns Hopkins, you'll find a website which has the 20 plus that we've done to date. You're welcome.
And it is applicable at the federal level.
It is absolutely applicable at the federal level. I just want to clarify, like, we're not scoring like the Congressional Budget Office scores, but you can use the same methodology on federal bills. We've done it on local bills. We've done it on state bills. I think there's a tremendous opportunity to look at federal bills and to bring health into the equation in a systematic way that's easy for people to understand.
Great, thanks. And thanks for the question. And sir, I think you're going to close us out today.
Thank you all for these presentations, and it's great discussion. Really appreciate it. A question raised, I think, Megan, by your presentation about definitions. You mentioned all the public health benefits of access to nature, and I was just wondering what counts essentially as an access to nature. Are investments in small urban parks beneficial, or would it have to be access to larger natural areas and so forth?
It all depends on the study, and the one study that I think is like one of the more fascinating ones is if you're in a hospital room and you can see green outside your window, you recover faster than if you're looking at a brick wall. So something that simple. Other studies are, a certain amount of time spent walking through nature, so it really just depends on the study. There's not one specific intervention.
Do you have a suggestion of maybe an organization that has like an especially good definition? Like, is there around some of these things?
Oh gosh.
To public land.
Yeah, thank you. Trust
Trust
for
for
Public
Public
Land, Nature Conservancy. There are a couple.
Good, thanks. Benito?
Just real quick, if you want an international example, Curitiba, Brazil, they actually have a metric that the regional planning organization does that parkland per capita, and they try to meet a minimum threshold, and when they drop, they try to find ways to add parkland so that everyone, doesn't matter where you are in the greater Curitiba metro area, you have just as much access to parkland.
And I will say, here in the U.S., we have, there's some NASA data and NOAA data that measure green space and using satellites. So there are measures that you can use here too.
If you look up a briefing that we did last May, I think it was American, it was a Tree Equity Score was the name of the program that we highlighted, American Forests. And that was a great presentation that they gave for us. So that would be another, I think, good lead to track down. Really interesting stuff, and very granular, actually. The data is it's very detailed. We have the data. All right. All right, so that brings us to the end of our briefing today. Thank you to our panelists for being with us today. Thank you so much. Thanks for everyone who stayed with us through the end, and thanks to everyone in our online audience for joining us today. Big thanks to Transportation for America for being our great partners today. Big thanks to American Public Health Association for being our partners today as well. And Jacob and Keshia and Megan, thank you so much for being great panelists. Representative Tonko helped us with the room, so great. It worked out really well. Thank you once again, Representative Tonko. And we heard some great remarks at the intro, at the start, from Representative Takano. So thanks to him and his great staff for making that possible. We have a great team at EESI. Thanks to Dan O, to Amory, to Allison, to Hannah, Anna, Molly, and Nicole for all of the work bringing the briefing together today. We have 3 great interns, one of whom is with us, Hadley. Thanks for being a great intern. And Raneem and Whitney, you're also great interns, even though you're not with us today because you have classes and school stuff you have to do. Troy, thank you for being our videographer once again and helping bring this to our online audience. This is a QR code for our survey. If you have a moment or two to take the survey, we read every response, and if you have any suggestions or any things that weren't working with the live cast or whatever, just let us know. We really appreciate all of that. Oops, that's it. So we will be back in a couple weeks about a briefing about insurance in the era of climate change. We'll also be doing lots and lots more coverage of surface transportation. If you want to keep up with everything that we do at EESI, subscribe to our biweekly newsletter, Climate Change Solutions. Today's Thursday. So the last issue came out on Tuesday, and so it skips a week biweekly. I guess biweekly could also mean twice a week. Semi-week? Oh, whatever. It's every other week. Every other Tuesday specifically. So check that out. It's a great way. We also do legislative tracking, bill tracking. Well, I guess that's the same thing too. Plus all of our articles and other goings on, media coverage, all of that. So it's a great resource. Thanks to everyone for joining us today. Thanks again to our great panelists and to T4A and APHA for helping bring the briefing to everyone. I hope you have a great rest of your Thursday and a fun train ride home. Hopefully you'll get some good reading or podcast time in. That's right. Thank you.